things. Welcome to July 12th. I feel like we haven't been here for a while. Maybe it's because I haven't been here for a while, but this is our July 12th IAM session. And today's topic is about the criminal justice system and the involvement that many people with traumatic brain injuries often find themselves involved with the criminal justice system. So you may have read in the blurb about today that there was a recent study that showed that 60% of those with criminal justice involvement have a traumatic brain injury, or TBI. That's an acronym you're going to hear today. So we want to make sure everyone knows what that is. TBI, traumatic brain injury. And this is compared to 8.5% of the general population. So 60% of those with criminal justice involvement have a traumatic brain injury, whereas in the general population of humans, there's only 8.5% of people with a traumatic brain injury. So we invited NajahBritton to come and talk today about this issue that's, we feel, been largely ignored by the criminal justice and parole systems and has had a significant impact on people with traumatic brain injuries. I'm going to introduce Najah in just one second, but just a couple of quick housekeeping things. You may have heard us chatting ahead of time, but we're happy to take questions. As the presentation is going along, Najah is going to use a PowerPoint, so you'll see that come up, which then means you usually don't see all the other faces on the screen and kind of have a clue as to what's going on. But you can use, if it works for you, you can use the chat box to put questions in. If not, you are welcome to raise your hand and we will watch for you and take questions. If neither of those options work for you, you can also just wait until we get an opportunity to take a little break and open the floor for questions, and you can unmute yourself and ask questions at that time. So hopefully that covers all the accessibility needs. I'm Sarah Basehart, the Executive Director at Independence Now. I guess I should introduce myself as well. And I'm happy to bring to you today NajahBritton, who serves as the Health Educator and Support Services Case Manager at the Brain Injury Association of Maryland. In her role as the Support Services Case Manager, she serves as a resource coordinator, helping with finding community resources for Marylanders living with brain injuries, their families, and the professionals who serve them. Najah also has experience as a mobile PRP caseworker, providing psychiatric rehabilitation services and supporting individuals with mental illness for the purpose of facilitating their recovery within the community. She has a Bachelor's of Arts in Psychology from University of Maryland, Baltimore County, my alma mater as well, and her Master's of Health Administration is from Walden University. So welcome, Najah. I'm going to turn things over to you. I think I've covered all the basics, and hopefully everybody's going to learn so much.
Thank you, Sarah. I appreciate it. Let me share my screen. Okay, so I'm going to be talking about the prevalence of brain injuries and those involved in the justice system. This presentation is brought to you by the Brain Injury Association of Maryland. Again, my name is NajahBritton. As Sarah mentioned, I am one of the support service case managers for the Brain Injury Waiver, and I am the health educator for the Brain Injury Association of Maryland. Also, when Sarah mentioned, just this fact, I have a bunch of facts in here, that the recent study found that 60% of those in the criminal justice system involvement has a TBI. So that's almost half of the criminal justice system. So today, here's a brief overview of what I'm going to be talking about. So TBI, or traumatic brain injury, that fingerprint, what that actually means. I'll be also talking about the changes that could happen after a brain injury, growing into a brain injury. I'll explain that. I'll talk about brain injury and substance use, and then talk about a little bit of facts of prison and TBI, and then also addressing how to address TBI in prisons and then also outside or when they're released, and then close with some resources. So TBI or ABI fingerprint, so that's traumatic brain injury or acquired brain injury, and I'll get into those definitions a little bit later. So As some of you may know, that there are 4 lobes in the brain. There's the frontal, temporal, parietal lobe, and occipital lobe. Each lobe has its own function, but I won't be getting into all the lobes and its function in this presentation. We do have a brain injury one-on-one video on our YouTube page, so I'll also share that with Sarah so she can share that out with everybody. But today I'm going to be really focusing on the fingerprint and those 2 lobes that are involved in the fingerprint and having the biggest effect when injured. But first, I'm going to be talking about the skull anatomy. So the skull has its round layers designed to protect the brain from any penetrating injuries. But however, if you look on the inside of the skull, as you see on the screen, you can see that there's some ridges on the inside of the skull. So it's the opposite of smooth. And with your brain, it has the consistency of overcooked cauliflower. So you want to keep that in mind. So with the fingerprint of the brain, when someone struck from behind or is assaulted in an injury, your head or your brain can shift in your skull back and forth, causing a coop, or so that's shifting back and forth. And again, for those ridges in the brain and your consistency of a cauliflower brain, it's not a really good mix. And so the frontal and the occipital lobe could get injured. And then your parietal lobe or your temporal lobe will get injured from like a T-bone accident, motor vehicle accident, or if you're getting hit from the side. I don't want to diminish the challenges that result as a damage to your occipital or your parietal lobe, but however, when law enforcement personnel or anyone who's just not associated with the challenges and behaviors with damages to the frontal and the temporal lobe, and those are the 2 lobes that make up the fingerprint injury, brain injury. So I will talk about the frontal lobe and its function. So the frontal lobe sits behind your forehead, and it's the closest area to those bone bridges I mentioned earlier. And it's responsible for your higher functioning skills. And you might be asking or wondering, what are those higher functioning skills, and or what does that mean exactly? So some questions or some things that I help work through this is think about how you're going to figure out what you're going to do in your environment, how are you going to react to your environment, or and responses, or what you're going to do within your environment, and the judgments you're going to do throughout your day and your daily activity. That's all those questions. You might not even think about it, but all of that is part of your executive functioning. And also your frontal lobe helps control your emotions, your expressive language, assigning meaning to words, involving words association, memory and habits, motor skills, flexible thoughts, planning, organizing. Oh, I see something in the chat. Is everybody also, if you can't hear me, please let me know.
You're a little bit crackly.
I'm crackly.
Crackly. That's the way I can describe it.
Okay, let me take these out and see if that helps. Let me see if Can you hear me now?
That's actually better, I think. I don't know what other folks.
All right.
Sounds better to me.
Okay. If I lag or anything, just let me know and I'll repeat myself. So yeah, we talked about the frontal lobe and the executive functioning. So the temporal lobe, like the frontal lobe, the temporal tip is immediately adjacent to the frontal lobe and are vulnerable for damage forced or applied to the head or neck. Some other factor or another factor that makes the temporal lobe vulnerable is that the temporal bone is the thinnest bone in the skull. So here's a little activity that
I'll say or like to do. It's like, so if you take your finger and press the front of your forehead, you'll press it and you're like, I can feel that sensation. It's kind of hard, I feel it. But then when you go to your temporal lobe or your temporal tips and you press in there, you're like, okay, that's a little bit more sensitive. I can actually feel that pressure a little bit more compared to the forehead. But if not, you can always go to another part of your head and press down in there. And you can see that you can feel that more sensation in your temporal bone right here, meaning it's the thinnest bone in your skull. Studies also show that in violent individuals or patients, the temporal lobe epilepsy suggests that dysfunction in the temporal lobe structure can lead to increased aggression, and also accumulating evidence of change in sexual behavior following the temporal lobe dysfunction. So we have on the screen I'm talking about the brain injuries, or the different types of brain injury. So brain injury or an acquired brain injury is an injury that is not hereditary, congenital, or caused by birth trauma. So in other words, it's a brain injury that you acquire after birth, or you get after birth. And an acquired brain injury is categorized into two categories. There's traumatic and non-traumatic, but it can get a little confusing because a non-traumatic brain injury is often referred as an acquired brain injury. And a non-traumatic or acquired brain injury is an insult or damage caused by internal factors such as stroke, aneurysm, lack of oxygen, exposure to toxins, tumors, whereas a traumatic brain injury, or TBI, can be defined as an alteration to one's brain function, insult to the brain caused by external or physical forces. So examples of those are falls, car crashes, sports, assaults. Not everyone has to do this, but what it might feel like living with a brain injury, it's a writing processing exercise. So you'll need a pen and a paper, and what you'll do with your dominant hand is write your name. So when you do that, you're going to whiz by that. It's going to be super easy. You're going to be able to do that quickly. How about try to write your name while patting your head on the top of your head, writing your name. Again, probably you'll be able to complete that task. Maybe take you a little bit longer, but you'll be able to complete it. So now let's switch to your non-dominant hand. And now try to write your name. You might be seeing that it might take you a little bit longer to write your name. If you want, you can always share what your observations during this exercise is. And then when you're finished with that, I want you to you have your pen or pencil in your non-dominant hand. I want you to lift your right foot off the ground, turn your foot counterclockwise. And to make it even more tricky, let's roll your tongue in your mouth and now write your name with your non-dominant hand. All at the same time. So you might see that it's taking you way longer to write your name, or you might have some other feelings come up. Maybe you're anxious or frustrated. So those are some things that can happen after a brain injury. There's also some physical and cognitive changes, which I will talk about. So after a brain injury, the nerves in your the cells in your brain may no longer send information to each other the way it normally does. So this is why people with a brain injury have changes in their physical abilities. So some of those may be fatigue, weakness, headaches, dizziness, trouble with sleeping, changes in your sensory. This can include vision, smell, touch, taste. Your speech could be slowed or slurred. You may also experience seizures, the motor skill, balance issues, coordination, and then your muscle strength and tone. There might be changes in that. Oh, I'm sorry, Cheryl. Less common physical changes is hemiparesis or hemiplegia. That's muscle weakness or paralysis on one side of the body and can affect your arms or facial muscle. Spasticity, that's limbs may become stiff, weak, and range of motion limited, and often affects one side of the body. And then apraxia, I believe that's how you say it, this is when a person can understand what to do and has physical ability to complete the task. However, his or her body simply does have trouble coordinating or cooperating to the best of their intention. So some cognitive changes that are common after someone who has a brain injury, of memory or attention, concentration, processing, problem solving. There could be confabulation. So this is a symptom where there's memory disorder, and the person would make up stories to fill in any gaps in your memory. Lack of awareness, organization, planning, and then also aphasia. This is an acquired neurogenic disorder. There may be receptive, so making sense of what was said or read, or expressive. This is finding it difficult to write words, to say or write, or both. And then persistence. This is what may happen when someone's unable to move on to another topic in the same conversation. So they'll return back to the topic over and over again. And some people might see it as like a cycle that's just they're unable to break. And then some other cognitive changes are judgment and impulse control. Lastly, just depending on the part of the brain that the person was injured, they might experience some significant behavioral or emotional changes. A person with a brain injury can cause a person to lose control over their emotional expression, and this condition is known as emotional liability. It changes in the way a person reacts to a certain situation, and which plays a huge role in their personality changes. While everyone experiences highs and lows, what separates emotional liability from normal mood swings is the extremeness of the emotion and how fast it can change. So a person might be laughing 1 minute and cry immediately after. Or the opposite can happen. Someone's personality may become muted or seem emotionless, and this can be called flat affect. People with brain injuries may feel anxious and might not exactly know why, or they might be worried about or become anxious about making too many mistakes or failing at a task, or this feeling of being criticized. Many situations can be hard to handle after a brain injury, especially moving within crowds, being rushed, adjusting to a sudden change in plans. And then the frontal lobe, again, it helps govern those personality and those impulsivity. I'm sorry. And if that's damaged, it might be that break in that braking mechanism for self-control. A person may find that they can't control their anger or aggression. And it's been reported family members with individuals with a TBI or with a brain injury often describe that individual having a short fuse or flying off the handle or easily irritable or having a quick temper. Some additional emotional changes that can occur could be grief around the injury, questioning their identity, depression, trouble recognizing social cues, difficulty initiating, and then difficulty with the relationships. That could be forming new ones or maintaining old ones. Okay. In 2016, based on a parental report, 8.3% of boys and 5.6% of girls aged between 3 and 17 have had a significant head injury in their life. And as their age increased, also the significance head injuries increased. So, and the peak is at 11.7% among children between the age of 15 and 17. So that brings me to my next topic of growing into a brain injury. So you might be thinking, what do I exactly mean by saying growing into a brain injury and not saying growing with a brain injury? And I'll explain it. So a brain injury that happens at the age of 7 might not fully unmask, or so that means being functional or behavioral, those side effects that, or yes, the changes after a brain injury that I mentioned might not come to face or be present until the age of 11, 12, or 13. And again, with the challenges of middle school and puberty, it can arise some behavioral issues as well. And then the frontal lobe and the temporal tip injury usually is unable to adequately respond to expectations of behavioral regulations and those executive skills, functioning skills. And as appropriately, when those structures often from schools, parents, the community fall away, going through adolescence and into adulthood, without the proper support, brain injury can lead to mental health, addiction issues, and can bring people into a hidden brain injury into the criminal justice system. The studies have followed children with brain injury into adolescence, into young adulthood, have found that they are more vulnerable developing substance use related disorders and become involved in criminal justice systems. So some possible risk factors, children, especially between newborns and to 4-year-olds, that's the age when they're learning to walk, and those are when children are at higher risk of falls, and that is the leading cause of a brain injury or traumatic brain injury. Impact sports. Young people who play football or other contact sports are at risk for concussion. In the last few years, okay, sorry, I was reading the chat. In the last few years, there has been an increase in the risk of concussion, and the incidence has more than doubled for athletes under the age of 19. And then people with lower incomes have found that they have decreased access to preventative measures like baby gates and possibly a safe place to play. I will read this question. How is brain injury treated during the COVID-19 era? There's still treatment going on. There's a combination between telehealth, but I can talk a little bit more about that at the end of the presentation. Also, I want to share some stats. Here are some statistics that 10 to 20% of people with TBI develop a substance use problem for the first time after their brain injury. Up to 50% of people receiving services for substance use disorder have a history of a TBI, and as many as 60% of people requiring inpatient rehabilitation after a brain injury have a history of substance use. So that will lead me into my next topic of TBI and substance use, or traumatic brain injury, I should say. So again, another study has shown that there's a strong correlation between substance use and brain injury. What is known to be and observed regarding the impacts is opioids and brain injury or overdose. So opioids suppress the respiratory system to the point where the respiratory system is distressed or is in arrest, which can lead to hypoxic or anoxic brain injury. Hypoxic brain injury is a lack of oxygen. Anoxic is when there's no oxygen getting to the brain. I usually think of all starts with A, anoxic starts with A, so that's how I remember it. So with that, so when there's a sudden loss of oxygen to the brain, there's a great effects to the brain that have the higher oxygen use, such as the frontal lobe and other regions. And when there's that disturbance in your oxygen, it can lead, it can have some negative impacts on your everyday functioning and increasing the likelihood of poor social or vocational outcome. It can also slow your reaction time and increase your impulsivity and decision making. And I will say that according to the US Department of Justice report, it was about 52% of women and about 41% of men offenders were under the influence of drugs, alcohol, or both at the time of their arrest. Studies also said that inmates self-reported health incidents that inmates with one or more head injuries had significant higher levels of alcohol or drug use during the years preceding their current incarceration. Although more than half of the prison inmates have a lifetime history of drug use, fewer than 15% are receiving substance use treatment service while in prison. So TBI within the justice system. So here I'm going to share some facts. Women inmates who are convicted of a violent crime are more likely to have sustained a pre-crime TBI or traumatic brain injury or some other physical abuse. Inmates with head injuries often have seizures, mental health problems such as anxiety or suicidal thoughts or attempts. Correctional professionals and law enforcement officers are at risk for head injuries or fatal head traumas. So the law officer that you might be, or anyone's interacting, they might have also be experiencing those emotional side effects like aggression. Also, the interactions with the suspects prior to arrest with inmates during their incarcerations are considered high risk situations for injuries for death due to head trauma. So here I'm also going to share a video just showing that there are strategies that can be implemented to reduce these head injuries. I think I will click it here.
A concussion can occur even without blacking out or losing consciousness and may not.
Can you guys hear that okay?
Yes, we can.
Okay, thank you.
Appear on brain scans. These symptoms, such as headaches, nausea, blurry vision, dizziness, fluctuating mood, sleep disturbances, or foggy, slowed down thinking, can occur because the brain is working harder to recover affected cells. Though many people recover fully from a concussion, if you experience any signs or symptoms as a result of hitting your head or strong external forces, take notice and seek treatment if symptoms worsen. We will now bring together what we have discussed about the brain and changes after a brain injury with specific scenarios. We will suggest strategies to help foster positive interaction with these individuals who have a brain injury in the community.
911, what is your emergency?
Hi, I was just involved in an accident. I accidentally hit another vehicle and now
he's screaming at me, banging his fist against my car, and I'm really afraid to get out of my vehicle.
Stay in your car, ma'am, and officers will be out to your location right away. Is he threatening your life, or does he have any weapons that you can see?
No, he's just sort of yelling loudly, but he hasn't threatened me.
What are you waiting for? Yo, look at my car. Look at my car. Yo, get out this car. Get out this car. Get out this car. Hey, step away. Step away from the car. Hey, step away. Look at me. Look at me. What? Step away. My car. Keep that cane on the ground. Lower your voice. No, that car, man. Can you understand? You need to lower your voice and listen to me. And you keep that cane on the ground. I need this cane, yo. And you need to break away from her. No. When interacting with a person with brain injury, a commanding presence and exclusion of family members can considerably deter rapport building. A display of aggression or negative behaviors could potentially further escalate by turning it toward the officers or leading to harm of oneself or others. Let's see how the situation would differ if the officers take a more calming tone, tactically communicating with the family and individuals from the distance, maintaining attention and building rapport. Look at my car. Yo, look at my car. Yo, come on now. Come on, get out your car right now. Because I ain't there for this. I ain't there for this. What are you doing? What? Officer Mack with the office. I don't care who you are. Yo, that's fine. Okay. Man, look at my car. Yo, I just got that car, man. Can you tell me your name? John. My name's John. But yo, it don't matter right now. All I care about is my car. You know, that bitch came. I understand. She just driving all over the place. Okay, Officer Mack, we just need to calm down just a little. Okay? Well, I'm just saying, we're gonna work this out for you. Oh, God. Okay, it's okay. Just relax. All right. First of all, are you okay? Were you injured? I'm all right, but my poor, what's your wife? Yeah, sorry. Okay. Yeah. And I'm gonna have to talk to this young woman too. Okay. I don't care about her. Everything out. I do. She's in my car. That'll be my car. Yeah, she's gonna work all this out. John, you don't be strong. John, you can just look at me. Man, what's your strong for? Okay. Okay. Would it be okay if we just kind of walk over here? Yeah, it's all good. All right. Come on, let's walk over here. We're gonna be all right. We're gonna work it all out for you. I promise. Austin.
Okay. I did see there was another question. People coming from home, from Iraq or Afghanistan, like for brain injury or PTSD. I will say that military or service members, they are in higher risk or to have a TBI. An interesting fact is that it's most likely more common in non-combat personnel, but it would be also with people who are out in combat as well. And yes, PTSD, you don't have to be coming home from war to have PTSD after a brain injury. It doesn't matter, even the event that you had your traumatic brain injury, you can develop PTSD from that incident as well. So addressing TBI within the system. So inmates who report having a head injury or a brain injury are often have disciplinary problems during incarceration, and their side effects are the changes after their brain injury may be read as being deliberately defiant. However, there could be attention deficits, and this might make it difficult for an inmate with a traumatic brain injury to focus on a required task in response to direction when given by a correction officer. In these situations, interpreted and lead to the impression of being deliberate or defiant on the inmate's part. However, there are management skills for that type of situation. So asking the inmate to repeat what you said, to confirm if he or she heard or understood the direction. You can encourage the inmate to write down steps for tasks. You can allow time for the task to be done, and you can clear or reduce environmental distractions. There can be also memory deficits that can make it difficult to understand or remember rules, which may lead to more disciplinary action by the jail or prison staff. So some management skills for that is explaining the rules and directions slowly, step by step, asking the inmate to repeat the steps to encourage them to write the information down, and providing examples and asking the inmate to provide his or her own examples, I should say, and then teaching the inmates to ask questions when he or she does not understand. There can be flowed verbal or physical responses that may be interpreted by the corrections officer for being uncooperative behavior. So some management skills or strategies could be giving direction or asking questions, slowly repeating if necessary, allowing the inmate, again, additional time to respond. Irritability or anger may be difficult to control, which can lead to incidents with another inmate or correction officer. So such incidents can lead to further injuries from inmates with a TBI or other. Again, so management skills, avoiding argument with the inmate, trying to rephrase the problem, breaking it down into parts, using positive reinforcements, and then your impulse behaviors. So this could be unacceptable sexual behaviors. It may provoke other inmates or result to disciplinary actions by the jail or prison staff. So management skills for this could be telling and make calmly that the behavior is unacceptable, seeking assistance from mental health professionals. Again, some key points for a survivor of a brain injury. You remember that the brain injury is considered a hidden injury and usually cannot tell from their physical that they have this disability. So you want to ask the person how you can support them. You want to avoid these arguments. You want to avoid quizzing the person. Instead, you want to try to give them offering memory cues and then be patient with the individual. So addressing the problem within the correctional system. A recent report from the Commissioner on Safety and Abuse in America's Prison recommend an increased health screening, evaluation, and treatment for inmates and development on partnership with the community health providers to assure continuing care and case management for released inmates. In addition, TBI experts and some prison officers have suggested routine screening in jails and prisons to identify a history of a TBI. You want to also try to screen inmates for a possible alcohol or substance use and provide treatment for those co-occurring conditions. Conduct additional evaluations and identify specific traumatic brain injury related problems and determine how they should be managed. And then special attentions to those given to individuals who exhibit impulsive behavior, which can include violence, sexual activity, and also increase attention to individuals with suicide risk and inmates who are depressed or is depressed. So I'll briefly go over some screening tools. I just want to do a quick reminder. So the screening tool is a process to evaluate a possible presence, and the outcome is usually just a yes or no answer, and not to be confused with an assessment, which is defined as is supposed to define the nature of the problem, determine diagnosis, develop a treatment and recommendation to address the diagnosis. The two screening tools that I'll be going over are, it's called HELPS, and then the abbreviation is OSU-TBI, which stands for Ohio State University TBI screening, I believe. I think I had it on the other slide. Yeah, Ohio University Identification Method. So HELP is a brief 5-question questionnaire, including additional prompts, and it accounts for an acquired brain injury and a traumatic brain injury. And then the OSU, or the Ohio State University TBI, is a standardized questionnaire. Again, it can be conducted within 3 to 5 minutes in a structured interview process. And it's screening for the likelihood of lifetime exposure to a traumatic brain injury. It does not screen for an acquired brain injury. So here is an example of the HELP screening tools. As you can see, HELP actually is an acronym to help you with the questions, asking if you ever been hit, have you ever been in the emergency room, have you ever lost consciousness. P is asking, do you experience any problems with your daily life since hitting your head, like headaches, dizziness, anxiety, difficulty concentrating, just to name a few. And then this S that's where there's this screen of an acquired brain injury. So a significant sickness like a stroke, brain tumor, oxygen deprivation. And here's the Ohio State University. Again, it asks you about 5 questions. I don't have the questions typed out in front of me, but it asks mostly about traumatic brain injury, and then it will ask you a little bit more in-depth information or probing questions for more information about their brain injury, such as how long you lost consciousness, when the first time you lost consciousness, if you had multiple hits to the head, if you had any recent hits to the head or severe hits and any impairments. Okay. One study shown that recidivism or re-entry into the criminal justice or being rearrest rate is nearly 70% of people with TBI or with a traumatic brain injury. That is twice the general recidivism rate. So a traumatic brain injury can create challenges to manage offenders and their success in community reentry upon release. So here are possible ways to address a TBI after release from prison. So the lack of treatment and rehabilitation for inmates with mental health and substance use problems while incarcerated increase the probability that they will again use alcohol and drugs when they are released. So substance use can lead to homelessness, return to illegal drug activities. It can increase the risk of death after release. As a result, the criminal justice professionals and TBI experts have suggested that community reentry staff should be trained to identify or screen for a TBI, so possibly using the screening tools that I mentioned before, having access to appropriate consultations to other professionals that have expertise within traumatic brain injury. Transition services should be capable to accommodate the effects of an inmate with a traumatic brain injury upon release of their and return into the community. And release inmates with mental health or substance use problems should receive case management services to assist with placement into the community and treatment programs. So some key takeaways. So children who sustain a TBI at a young age may be able to recover physically after their accident. However, without the proper support of a brain injury, it can lead to mental health and addiction issues that bringing people with hidden traumatic brain injury into the justice system. Also, alcohol and other use of are strongly associated and increases your chance in involvement in criminal justice and involvement in the criminal justice system. And TBI, they should be, and the justice system needs to accommodate within the justice system when they are released and their re-entry programs. Lastly, I will close with some resources. There's the Brain Injury Association of Maryland. As Sarah mentioned in the beginning of the presentation, we do help find local resources for individuals living with a traumatic brain, with any brain injury and their family. There's the health issue in correctional settings, and that site provides information for public health and criminal justice professionals about health topics and the emphasis of infectious disease and the correctional settings. It also has materials for the general public with links to related organizations. There's the Inmate Partner Violence, so IPV. This site provides information for professionals and general public regarding the inmate partner violence. The site contains an overview and fact sheets about IPV, or inmate partner violence, prevention strategies, and links to other preventative organizations. The legal issues for persons with TBI in the correctional setting, the National Disability Right Network. This site provides information about law protection, protecting civil and human rights for persons with disability, including individuals with a traumatic brain injury and incarcerated persons with disability or their family, and can receive help through the network regarding prisoners' legal rights, access to mental health services and medication, and restorative benefits upon release. And then lastly is the substance use mental health services. The site provides information about treatment resources for persons with or at risk for mental and or substance use problem. Also, the sites provide information for professionals regarding alcohol and other related disorders. The site has materials for a specific population, age group, and there's also a hotline to support organizations. Again, my name is NajahBritton, one of the support service case manager, health educator for the Brain Injury Association. There's my contact information. And then here are some of the references that I used for this presentation. I saw that there were some questions.
Yeah, there's one question in the chat, and then we wanted to double check that you're going to send your slides to me so that we can distribute, just because there's so many resources on there people might want to refer to.
Hey, I have a question.
Okay, hang on, Chioke. We got one in the chat. Okay, just 1 second. Nikki Savoy asked, is there any data that shows a correlation with forceful interactions with law enforcement and increased rates of traumatic brain injury in those who have been through the criminal justice system? I think you touched on that a little bit.
Yeah, I have to do further. I'll probably have to do a little bit further research, but there is I did touch on it a little bit about how during the arrest process, there's that risk for a head injury, and also within in the system as well, especially if there are, as I mentioned, those effects after a brain injury, they might be read as being defiant or not being cooperative.
Nikki, did we cover some of that maybe before you had asked the question, maybe before we hit some of it?
Well, thank you for taking my question. I was just thinking about some of the more recent high profile cases where asphyxiation and chokehold techniques were used in trying to apprehend a person, and forceful behavior used by the officer responding to the situation. And I was just wondering if there had been any research or data specifically on cases like that. But thank you.
Yeah, I haven't seen any, but there probably will be more studies, especially with the most recent high-profile cases. But I kind of touched on, like, there is that agnoxic and hypoxic, I think that's how you say it, trauma to the brain. So if there's that lack of oxygen to the brain, so that disturbance, you're putting that disturbance onto your respiratory. Again, you're not getting that oxygen that by your brain, especially your frontal lobe. It needs that oxygen to it takes up a lot of the oxygen, so it most likely will be affected a little bit more because of that lack of oxygen or no oxygen to the brain. So even though there's no studies saying that there is correlation, but if you're cutting off your oxygen, there is going to be that correlation there. There's also been a little bit of study with COVID, with people going on to the respiratory systems because respirators, because there is that lack of oxygen. So they also have seen that there are some side effects, brain injury, like that agnoxic and hypoxic brain injury as well.
Cheryl has left the meeting.
Thank you. Okay, Chioke, did you have a question?
Yes, I had a question with what she was saying regarding, the criminal system, but also, the military. Like I was asking you saying that it's not, those with PTSD or those that with what happened at Abu Ghraib and seeing, like we said, correction. It's not. You saying it's the lowest rate? You said.
No, I think you said that the higher rates of traumatic brain injury from military service were actually in non-combat situations.
Yeah.
In the more recent years that there have been so many brain injuries with the explosions that happen, but there's not necessarily, direct combat going on. I've read that as well, that
Wow.
tends to be the higher rates.
Not even those, detainees at Guantanamo or Abu Ghraib years ago.
I've not read about them, so I wouldn't know. Do you know that, Najah? Or?
Unfortunately, I'm sorry.
It's pretty specific. I'm guessing they might not write about that.
But I had another question. How about people that have been shot, like Gabby Gifford?
Mm-hmm. Yep,
they at a high risk for like if they get shot in the head point blank.
Absolutely. I think that's definitely one of the ways you mentioned that traumatic brain injuries occur, right, Najah, in the violent criminal activity.
I'm sorry, my computer was like breaking up. I was trying to close the screen to see if that would help. What was the question?
About people who have been shot, like Gabby Giffords. I put that privately in the chat.
Of course, that would cause absolutely.
Yeah, she was the congresswoman.
Yes, I think that might fall under assault. I didn't put it in this presentation, but the leading cause of a non-fatal brain injury is falls, followed by struck by or against. So that's like a body part, object. This can include like furniture falling on you. Then I think it's assault, car accident. I might have been switching those two up. And then I really not.
It's in the top 3 or 4, Chioke. I think that would.
Yeah, because I can see. Because have you seen?
Sorry, I need
her lately.
I just need to see if there's any further questions, and then do very quickly, because it's 3 o'clock. And if there's any other any announcements, I know Cheryl Grossman wanted me to make an announcement that they have some Moderna vaccines available today for. And Kelvin's asking to $10,000 question, which my staff, which I already know the answer to, but if you are interested in having the Moderna vaccine today and you live anywhere between Baltimore and Silver Spring, they are willing to come to your home. So Heather, I might ask you to put Cheryl's phone number in the chat so someone could call her if they were interested in receiving that today. You know how these vaccines go. You have very limited time to get them out into arms once they start it. So any other questions for Najah? Najah, that was like chock full of information about brain injuries, the data.
Sarah?
I'm sorry if I threw a lot of information out to you. I'm sorry if the writing activity offended anybody. I did not mean to offend anybody. It's just to kind of get an understanding. It does not mean it's equal or anything like that. So again, I don't mean to offend anybody for that. I hope that the information wasn't too much.
Well, Joe, did you have a question?
I did. Thanks, Sarah. Najah, it was a great presentation. I was just curious, you mentioned that percentage, 60%. I was just curious the source for that. Whether it's the 60 you mentioned up front, 60% of.
I can send it to you, Joe. Actually, okay. Anastasia Edmondson, who does some brain injury trainings around, she sent me the whole study. So if you want it, you can have it.
Okay, I'm curious because I do know there's been a lot of attempts to, like you mentioned, I like the video because there are a lot of attempts to de-escalate by the language the officer is using. I know Prince George's and other counties are currently doing that, are incorporating, but yeah, thank you. I'd be curious about to get a copy of the survey just for reading purposes. But great presentation. Thank you.
Thank you.
That's all I had, Sarah. Thank you very much.
And I know that Kelvin from Independence Now is asking if all inmates are evaluated for TBI. And I think that's when I met with Brain Injury Association, that's one of the difficulties is that they're not.
Yeah.
And so then there isn't knowledge when supporting someone, in the criminal justice system, if they have a TBI already, or if they, experience one while in the criminal justice system. So Heather, go ahead. Sorry, I know.
So how did the TBI interact with existing like learning disabilities or cognitive issues such as ADD or dyslexia? I know my background's actually in correctional education, and what we were seeing among the prison population is that learning disabilities were far more prevalent in the inmate population than it was in the general population. So I'm curious if TBI affects executive management functioning. Are they working? Do the existing therapies work with things like dyslexia or ADD, other types of issues that could be exacerbated by a traumatic brain injury?
That is a really, really good question. I'm going to be honest with you. I've never thought to research more into the developmental disabilities. But I do know that there's a big correlation, or it said that the substance use disorder, it can also be exacerbated by the traumatic brain injury. So I wouldn't be surprised that there could be a correlation between the two. Again, there's just, I'm sad to say this, but there's like very limited resources and specialties related to brain injury. So finding that therapists or that neurologists or psychiatrists who have that background might be limited. But again, we do have some resources on our database, so you don't hesitate to ask and call over. Yeah, that's all I can think of.
Thank you.
I couldn't really answer your question. I feel bad.
That's okay. We can, I would like, when we get your slides, I would like to include the list of resources that you had at the end when I send our follow-up email out so people can access those.
Oh, yes, of course.
Well, thank you, Najah. Sorry, Jerry. Clearly, we should have allowed more time for questions. Go ahead, Jerry.
I'm sorry.
Jerry, go ahead.
Oh, concerning the military documentation, the reason the non-combat statistics are higher is because They usually occur in training facilities. They have medical professionals on site that document those injuries. Trust me, combat, there is no one around the injuries. And, you know, I spent 29 years there and 3 concurrent tours in Vietnam. And so you realize that a lot of men come and they go and they never get evaluated, turn out onto society. And so things are getting better. We are training the law enforcement to recognize TBIs, especially from military, because those men and women are extremely dangerous. And so their behavior can escalate to the point that either they get killed or they will kill the officers. So those stats, the only reason they're skewed is because there's no one in combat to document.
Thank you for that information. I appreciate it.
Thank you, Jerry. All right, I guess I'll call real quick for any other community announcements.
I have one.
Go ahead, Brittany.
Hi, I'm Brittany. I'm with ARI, but this is on a different, I'm putting my other hat on. I am Miss Wheelchair Maryland 2021, and we are looking for the next Miss Wheelchair Maryland and DC. So if you're a woman and you use a wheelchair full time, you can contact myself or Shannon Minnick, and we would love to have you guys compete in the fall. Thanks, that's all I got.
Thank you. Anybody else? Okay, well, we do have an IM session next week, and it is on accessible gardening. So if that piques your interest, please tune in next Monday at 2 o'clock for the IM session. And we have a couple of experts coming on to talk about accessible gardening. And we thank you very much, Najah, for a chock full of information presentation. And maybe we'll be back in touch for a second round or a round of just questions with the Brain Injury Association, where we could just have a little more time to have, questions and so on, because it is a topic that I think most of us don't get enough of an opportunity to talk to experts. So thank you, and we'll see everyone next week.